আমাদের চিফ গেস্ট আছেন আমাদের প্রিন্সিপাল স্যার, চেয়ারপারসন আছেন আমাদের মেডিসিনের প্রফেসর একেম আমিনুল স্যার, এবং প্যানেল অফ এক্সপার্ট ছিলেন 3 জন, এখন আছেন 2 জন। ওনার নাম আমরা রেখে দিয়েছি ওনার সম্মানার্থে, প্রফেসর একেম মুর্শেদ অ্যান্ড প্রফেসর ডক্টর মোহাম্মদ সুলতান উদ্দিন। স্পিকার, প্রথম স্পিকার ডক্টর মেহরুন্নেসাকে তার উপস্থাপনা শুরু করার জন্য অনুরোধ জানাচ্ছি।
Honorable Chief Guest, Chairperson, panel of experts, my teachers, seniors, and my fellow colleagues, Assalamu alaikum. Today's our seminar is on Ramadan Easy for All. We dedicate this seminar to our respected sir and mentor, the man who worked relentlessly to guide us and help us make this presentation till he left us on 24 June due to a road traffic accident. We mourn at this irreplaceable loss. May he be granted Jannah. Myself, Dr. Kolimullah, along with Dr. Nusrat Jahan and Dr. Qazi Audi Arafat Rahman will be presenting here. Starting the presentation. রোজা ফার্সি শব্দ, রোজাকে আরবি ভাষায় সাউম, বহু বচনে সিয়াম বলা হয়। আল কোরআন ও হাদিসে রোজাকে সাউম বলা হয়েছে। এর আবিধানিক অর্থ হলো কোনো কিছু থেকে বিরত থাকা। রোজা মানুষকে পানাহার এবং যৌনাহার থেকে বিরত রাখে, নফসকে বারণ করে এবং শয়তানকে বান্দার কাছ থেকে ফিরিয়ে রাখে বলেই এর নাম হচ্ছে সাউম। সাওমের মতো রমজান শব্দটির অর্থ ও তাৎপর্য আমাদের অনুধাবন করা দরকার। আরবি রমজ ধাতুটি থেকে রমজান শব্দটি এসেছে। রম ধাতুটির অর্থ আরবি অভিধান ও আরবি সাহিত্যে পাওয়া যায়। এর এক অর্থ বছরের প্রথম বৃষ্টি। আরব দেশে বছরের প্রথম যে বৃষ্টি বর্ষণ হতো তাকে রমজ বলা হতো। বৃষ্টিতে যেভাবে মৃত জমি সুজলা সুফলা শস্য শ্যামলা হয়ে ওঠে, ঠিক তেমনি রমজানে সাওম মৃতপ্রায় মানুষের আত্মাকে নবশক্তিকে বলিদান করে। রমজান ধাতুর আরেকটি অর্থ পুড়িয়ে ফেলা, জ্বালিয়ে দেওয়া। রমজানের সাওম মানুষের গুনাহকে জ্বালিয়ে দিয়ে পুড়িয়ে শেষ করে দেয়। সাওম নফসের খায়সাতকে জ্বালিয়ে দিয়ে মানুষকে আল্লাহর খাঁটি বান্দা বানায়। এ বিষয়ে মহানবী হযরত মুহাম্মদ সাল্লাল্লাহু আলাইহি সাল্লাম বলেছেন, যে ব্যক্তি ঈমান ও আত্মসমালোচনার সাথে রমজান মাসে সাওম পালন করবে তার পূর্বেকার সকল গুনাহ মাফ করে দেওয়া হবে। Ramadan is the 9th month of Islamic calendar. It is observed by the Muslims worldwide as a month of fasting. This annual observance is regarded as one of the 5 pillars of Islam. The word Ramadan comes from the Arabic root Ramida or Araman, which means sorrowing heat or dryness. Surah Baqarah, chapter 2, verse 183 to 185 of the Quran states, chapter 2, verse 183, O who have believed, decreed upon you is fasting, as it was decreed upon those before you, that you may be righteous. Chapter 2, verse 184, fasting for a limited number of days. So whoever among you is ill or on a journey during them, then an equal number of fasting are to be made up. And upon those who are able to fast, but with hardship, a ransom as substitute of feeding a poor person each day. And whoever volunteer excess, it is better for him. But to fast is better for you if you only knew. Chapter 2, verse 185. The month of Ramadan is in which was revealed the Quran, a guidance for mankind and clear proofs of the guidance and the criterion of right and wrong. And whosoever is present, let him fast the month. And whosoever is sick or on a journey, a number of other days. Allah desires for you is, He desires not hardship for you, and that you should be complete the period, and that you should magnify Allah for having guided you, and that perhaps you may be thankful. Al-Siyam. Roja in Persian or Al-Siyam in Arabic must not be equated with normal fasting. Al-Siyam is something sublime, noble, exalted and majestic. It calls for full exercise of self-restraint on all those senses and limbs, a total and absolute control over all evil acts and desires. Al-Siyam is obligatory for a person if he fulfills 5 conditions. 1. He is a Muslim. 2. He is accountable, mukallaf. 3. He is able to fast. 4. He is settled, not traveling. 5. There are no impediments to fasting. Gastrointestinal diseases in Ramadan. Peptic ulcer disease. There is no evidence that fasting causes peptic ulcer disease. The stomach is at rest while fasting, so secretion of local hormones such as gastric juice, gastrin, mortinin, GIP, VIP, enteroglucagon, neuropeptide Y, gallium are reduced, hence decrease the chances of ulcer. It can be said that the annual vacation of 30 days of all GI systems, including the liver and pancreas, is refreshed. Those who are suffering from peptic ulcer diseases can easily take proton pump inhibitors and fast. It is not mandatory to fast a peptic ulcer patient with severe complications such as severe epigastric pain, hematomesis, melena. It is advised for these patients to immediately consult a specialist doctor. Inflammatory bowel diseases. Ramadan fasting may induce changes in gastrointestinal physiology. A cohort study was performed to see the effect of fasting on inflammatory bowel disease. There was no correlation between the number of fasting days and the severity of the disease. So it appears that Ramadan fasting does not impose serious risk on patients with inflammatory bowel disease. Irritable bowel syndrome. A study was performed to see the response of the patients of intractable IBS to fasting. The fasting therapy was used for treatment of patients with IBS. The basic treatment consists of pharmacotherapy and brief psychotherapy, whereas the fasting therapy consists of 10 days of starvation followed by 5 days of breathing. Changes in scores of symptoms before and after each treatment were analyzed. The results suggest that fasting has no adverse effect, rather it may be beneficial on intractable patients with irritable bowel syndrome. Now we are showing a video clip of first day of Ramadan at Masjid al-Haram in Makkah. Please enjoy the video.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Darul Sayyid and Sayyid Mahmoud. We are in front of the Kaaba in Masjid al-Haram in Makkah. Alhamdulillah, I can see the Kaaba right in front of me here. Today is the first day of Ramadan. Alhamdulillah, Allah subhanahu wa ta'ala has granted us the opportunity to be here today. It is now the time between Asr and Maghrib. Everyone is seated well in advance before Iftar. Nobody would like to give up these spots so near the Kaaba. If you were to leave after Asr, you would not get anywhere near the Kaaba before Maghrib. This is totally packed. As you can see, some volunteers are distributing dates. Iftar here is mainly dates and Zamzam water. Plastic canisters of Zamzam water have been placed between the rows so that everyone can access them. The way these canisters are designed, only small cups can be filled directly from these canisters. This is a way of preventing people from hugging the canisters to fill large cans or bottles. Apart from the dates and Zamzam water, some individuals distribute some other small items like the nuts and sometimes coffee and so on. And you might think that coffee for iftar is unusual, but it is not the coffee that you are actually thinking. This Arabic coffee is called qahwa or lahwa. Actually, that's where the word coffee comes from. It has a little milk, cardamom and cinnamon. It can actually be quite refreshing. Where I'm seated at the moment, there are only men here. Other than the times of the 5 Fard prayers, families can sit together and pray or just sit around. My wife was here with me a while ago, and then a lady came along and asked all the women to go over there behind those pillars, not too far from here. It is almost time for Maghrib, so this video needs to end soon, but
Thank you for watching. Now rest of the presentation will be continued by Dr. Nusrat Jahan.
Thank you, Dr. Mehrul for your nice presentation. Assalamu alaikum. I am Dr. Nusrat Jahan, continuing rest of the discussion on this topic. Respiratory diseases in Ramadan. No extensive studies have been found regarding respiratory diseases in Ramadan. However, the following recommendations are found. Use of metered dose inhalers have been allowed in a fasting patient. Dry powder inhalers like Cozy Cap, Rota Cap, Dixie Cap are prohibited while fasting. Long-acting theophylline are indicated. Cardiovascular diseases in Ramadan. There is a significant 4% reduced risk of ischemic heart diseases in patients who are fasting for 10 years. Significant rise in HDL level occurs in fasting patients. Cholesterol, triglyceride, LDL level is reduced. Fasting blood sugar, homocysteine, C-reactive protein level is reduced. Systolic blood pressure, BMI and waist circumference is reduced. Gynecological diseases in Ramadan. There is no religious bindings for digital vaginal examinations or any instrumental paravaginal procedures like hysteroscopy regarding breaking a woman's fast. Pregnancy and lactation in Ramadan. Pregnancy. Fasting in pregnancy appears to be safer for mother and her baby if she feels strong and well enough. Researchers have said that the average score of babies of women who fasted in pregnancy was no different from babies of women who did not fast. During fasting in pregnancy, talk to your doctors more frequently who will look for any possible complications that fasting makes you prone to, such as diabetes and anemia. Look for warning signs such as weight loss, dehydration, intense headache, fever, reduced baby movements, etc. If the mother feels any such abnormalities, she must consult a doctor and stop fasting. Fasting can be made easier in pregnancy by avoiding stressful situations and by taking things easy. Choose a variety of healthy foods and have plenty of drink at suhoor. Lactation. Milk production does not stop in a fasting lactating mother. If a mother takes her iftar and suhoor meals adequately and sincerely, she will produce sufficient breast milk to fulfill the 24 hours milk demand in any child aged less than 6 months. Lactating mothers must avoid doing heavy works and should stay stress-free. During suhoor, they should eat fish, meat, green vegetables and pulse. Then they should drink a glass of milk and a seasonal fruit, followed by drinking plenty of water. During iftar, they should avoid fried foods. They are encouraged to eat more seasonal fruits vegetable or chicken soups, dates, plenty of juice, curd, etc. Gouty arthritis in Ramadan. To help control gout, limit foods that are high in purines, especially organ meats, brain, heart, kidney, liver, beef, lamb, seafood, prawn, cabbage, cauliflower, brinjal, spinach. Eat a healthy diet that provides the nutrients you need and helps you control your weight. Some recommended foods for gout patients are whole grain like oats, brown rice and barley, sweet potatoes, fruits and vegetables, other than the high purine containing ones. Vitamin C rich foods also show evidence of potentially reducing gout attacks. Eat low-fat dairy products. Drink plenty of water and other fluids as fasting may cause dehydration, which rises the concentration of uric acid, thus precipitating gout. Kidney diseases in Ramadan. In a globalized society, the physicians have to face the issue of management of chronic kidney disease in Muslim patients that want to fast during Ramadan. Clinical recommendations for CKD patients willing to fast. Patients should take their treatment twice daily with suhoor and iftar respectively. They should break their fasting if plasma creatinine increases above 30% of the baseline values or if you observe the clinical symptoms due to changes in serum potassium and sodium. Patients should be instructed to recognize some alarming symptoms such as increase in weight more than 2 kg from baseline, lower limb or facial swelling, shortness of breath, dizziness, anorexia, fatigue, weakness or a sense of lethargy. Patients should attend regular follow-up every 1 to 2 weeks before, during and after Ramadan. When breaking the fast, they should avoid high potassium and phosphate diets such as dates, bananas, fried foods, nuts, cheese, tea, coffee. If they have a tendency to hyperkalemia, they should take some calcium resonium powder. Particular attention should be paid to infections. A study showed that all CKD patients who fasted the whole month of Ramadan had a good tolerance, tendency to weight reduction, and a lower systolic blood pressure and diastolic blood pressure. Estimated GFR showed a significant improvement. There was better lipid profile, reduction of proteinuria and urinary sodium. So, it can be concluded that it is absolutely safe for a CKD patient to fast in Ramadan. Topical skin medications and fasting. Applying cream to the surface of the body, whether to the breast or any other part, does not nullify fasting because it is not food or drink and does not resemble food and drink. There is no text in the Quran or the Sunnah or consensus or evident analogy including that whoever applies cream to his or her skin and perceives its taste or scent, his or her fasting will be broken. Now, we are showing a video clip of iftar around the world. Please enjoy the video. Dr. Kazi Audrey Arafat Rahman. Thank you.
Thank you, Dr. Mustafa Jahan, for your wonderful presentation. Assalamu alaikum. I am Dr. Kazi Audrey Arafat Rahman, continuing the rest of the discussion on this topic. ENT and Ramadan. There is contradictions as to whether eye drops will break a fast. Sheikh al-Islam Ibn Taymiyyah and a group of contemporary scholars have given their opinion that eye drops do not break fast, but it is preferable to delay using them till night just to avoid the disagreement. However, if one needs to use it during daytime, he may use it. And if he feels the taste in his throat, he should spit it out. Allah knows best. ENT. Regarding nose drops, if they reach the stomach, then they break the fast, according to what was reported in the hadith of Labid bin Sabira, may Allah be pleased with him. Eardrops do not break the fast if the tympanic membrane is intact, but if there is any perforation in the tympanic membrane, eardrops may break a fast. Oral hygiene and dentistry in Ramadan. One must brush his teeth properly after iftar and suhoor. There are no restrictions in brushing the teeth or using mouthwash or dental floss while fasting, but you should be careful that water or mouthwash does not enter the throat. To keep the oral cavity healthy, plenty of water intake, avoidance of high calorie and fatty food, plenty of fresh vegetables and fruit intake is necessary. Fried foods, fast foods and cold drinks should be avoided to reduce bacterial plague and caries formation. Diabetes and Ramadan. Some 40 to 50 million people with diabetes worldwide fast during Ramadan. Diabetic patients are at risk of harmful consequences due to changes in pattern and amount of food and fluid intake during Ramadan. The harmful consequences associated with fasting are hypoglycemia, hyperglycemia, ketoacidosis, dehydration, and thrombosis. Management of diabetes during Ramadan. Frequent monitoring of glycemic status, multiple times daily, especially patients on insulin, 2 hours after suhoor and 1 hour prior to iftar. Nutrition. In terms of calorie and composition, diet should remain same, healthy and balanced as before Ramadan. Ingestion of large amounts of food rich in carbohydrate and fats during iftar should be avoided. A complex carbohydrate that delays in digestion and absorption are good choice for suhoor. Food with more simple carbohydrate may be taken during iftar. Suhoor should be taken as late as possible. Exercise. Normal level of activity is recommended. Excessive physical activities may lead to hypoglycemia. Tarawih prayer can be considered part of daily exercise program. Breaking the fasting. If blood sugar goes less than 3.3 millimole per liter at any time or less than 3.9 millimole per liter during the first few hours of suhoor or more than 16.7 millimole per liter and on sick days. Medical assessment. Glycemic status, blood pressure and lipid profile are to be stabilized before Ramadan. Specific measure for type 2 diabetes mellitus. Risk of fasting hypoglycemia is low if on insulin sensitizers like metformin or glitazones, but risk increases when secretagogues are used. Bicarbonate needs some dose adjustment. Patients on insulin, dose readjustment is to be made according to the type of insulin. Patients on once daily drug regimen. The usual dose of anti-diabetic agent can be taken at sunset. Sometimes the dose need to be reduced. Patients on twice daily drug regimen. The usual morning dose of anti-diabetic agent is taken at sunset. The evening dose is reduced to 50% and taken at dawn. patients on thrice daily drug regimen. The total dose of metformin is divided into two parts. Half of it is taken at sunset and 50% of the rest is taken at dawn. In case of rapid-acting insulin or glinides, the usual dose can be taken with meals. Short-acting insulin is to be taken twice daily with larger share at sunset. Specific measure for type 1 diabetes mellitus. Some experienced physicians conclude that Ramadan fasting is safe for type 1 patients with proper self-monitoring and close supervision. 3-dose insulin regimen. 2 doses before meals, sunset and dawn of short-acting insulin and 1 dose in the late evening of intermediate-acting insulin. 2-dose insulin regimen. Evening insulin of combined short-acting and intermediate-acting insulin equivalent to the previous morning dosage, and the pre-dawn insulin consisting only of short-acting insulin. Now I will be talking about 10 incredible health benefits of fasting. Fasting promotes detoxification. Fasting rests our digestive system. Fasting resolves inflammatory response. Fasting reduces blood sugar. Fasting increases fat breakdown.